think again, yeah, thank you so much, and I'm really interested in this conversation. You know, the way that I found out about you is I was reading about social media and mental health, and there was an article in the Boston Globe that
Right.
you had written with somebody else, and I found it very interesting and compelling, and so that's really why I reached out. But maybe for starters, I'd love to learn a little bit more about your background as like
Sure.
uh, as a therapist, and then I'm also very curious, um, how when you started to see social media usage as a mental health issue, like when did that, approximately like timing, when did that start to manifest, and how did it start to manifest? But
Yeah.
I'd love a background.
All right. I mean, well, first of all, the article that you saw in the Globe was written by myself and a colleague, Cameron Mendez, a doctoral student, and he and I have worked together for a number of years. Uh, so really, I think together became very alarmed about social media, and I think I'll go through it a little bit. But first, my background, just so we can get that clear. I've worked in mental health for over 40 years now. So much of it has been spent actually working in psychiatric hospitals and many years working with adolescents. So, I kind of have that as a background. I'm a, I have a doctorate in social work from Boston College, and I'm on the faculty there. So, and I've kind of had just a really interesting career, both administratively, but also as a clinician. And I think for me, a dramatic time actually was the pandemic. So, it was working in a hospital. You actually have to go to work every day. So we were, it was kind of a very crazy time in our country, a very scary time. But, I found myself going into work every day. And counter to what we expected, we didn't have a decline in admissions. We had an overflowing number of admissions. In fact, we could have built another hospital and filled that too.
Mm.
So it was really dramatic to me that we were seeing so many people. And actually, we were seeing a lot of adolescents. So I was running, actually, I do a lot of administrative work now, but they do let me do a clinical work every day. So Cam and I
Nice.
were running an adolescent group, and you know, every once in a while it gets a little slow, so we tend to ask the kids questions. So somehow one of us, I'm not sure who, thought to ask how much social media people are on, how many hours a day, and we went around the room, and it was a real jaw-dropping moment because every kid was on for at least double digits hours every day, so 10 or more hours every day. And one kid saying, I'm on all the time. I even sleep with it. And it wakes me up at night anytime something comes through. So I was just like, wow, that's just amazing to me. And we got into a discussion about why. And they just very matter of factly explained, well, we went to school one day, we were sent home. Uh, we went home and we went into our rooms and we closed the door and we were on our device. And there we were for weeks to follow. And pretty much their only communication with each other and with the outside world was through a device. Um, so I thought that was just striking in terms of volume. Now, since then, I've done a lot of research on it, or just a lot of reading on it. And 95% of kids in our country have access to at least one device per person, and all can access the internet anytime they want. Most of those kids have access to two or more devices. So they're online all the time. And it's pretty clear in mental health that we've seen a real increase in depression, anxiety, suicidality, that sort of thing. And it's documented, from the pandemic. So, my observation is that these kids are really in trouble. They're spending an inordinate amount of time on a device and specifically on certain apps. And I do believe it's changing or distorting their sense of reality. So that's kind of the genesis of the articles we wrote. I think we wrote two for the Globe. We were on NPR for a while. We did some other things like that, public speaking. Uh, and I remember we did a parents meeting, and the auditorium was full. Parents are just very concerned about what to do. They all
Yeah.
kind of recognize the problem, but they don't know what to do. And people kind of go to, well, should I just take away their device? Or and one woman got up and said, I did an experiment with myself, and I got off my device for a month. And I said, well, how'd that go for you? And she said, well, I learned that I couldn't tune my guitar because my tuning app was on my phone. I couldn't take any pictures at Thanksgiving because that's my camera. And by the way, I couldn't get anywhere because I didn't have Google Maps. So she says it's essential that we have these devices, and I agree with that. So my slant is not that these are bad devices; they are incredibly brilliant devices. I think they become very challenging for adolescents.
Yeah. And so I'm curious also, just kind of like to paint the picture, like um maybe before we even dive into the pandemic and social media, like when we talk about the mental health of adolescents, what um how is, I guess, adolescent mental health different than, adult mental health, and what kind of issues do adolescents seem to be dealing with? What are you kind of helping them out with? I'm curious how that kind of compares and contrasts to adults, and then also I'm curious how that changed in the pandemic.
Yeah. Well, I think it breaks down by, a lot of clinicians don't want to work with adolescents. They only want to work with adults or vice versa. So you tend to specialize almost on preference. But I think adolescence is a very challenging time developmentally. So it's a period of life where people are going through dramatic physical changes, but exploring issues of origin, identity, and even ownership. So trying to figure all of that out, and then in a context of a really complicated social system that they live in, it breeds lots of opportunity for mental health problems, and they run the gamut. So it's really important to know that all of us as Americans will experience a mental health issue in our lifetime. Um, and some are going to be severe, but some are just developmental and to be expected. I think for adolescents, it becomes really challenging. So we see a lot of kids that struggle with depression, with severe anxiety, with eating disorders, um, lots of conflicts in families, that sort of thing. A lot of suicidal ideation. That's been a huge growth in this country.
Mm. Wow. And so going into the pandemic, you said you saw this significant overflowing of people that you were, helping. What exactly about, I mean, I know it seems obvious, but I also want to kind of like dig into the details. Like what exactly about the pandemic created such, internal struggles and mental health issues amongst adolescents, and also how does that compare to like the
Yeah.
issues that adults were dealing with?
Well, I think, I actually think we're going to learn about the pandemic for decades,
Yeah.
but
Yeah.
it certainly changed how we relate to each other. I mean,
Hmm.
you remember we were taught during the pandemic to be afraid of one another.
Yeah.
So there's no touching, there's no, limited communication, there was distancing, all that sort of thing. And, for kids who are trying to learn how to navigate a social life, that can be very, very damaging, really. It really kind of slows things up for them. But then I think, it was really the isolation. Um,
Yeah.
it is so important during adolescence for kids to interact with each other, to interact with the world. And they were really pulled back from that. And that I think was quite damaging.
And were there particular symptoms that you were seeing a lot during the pandemic, whether that be suicide ideation or depression or anxiety? Was there something that was much more pronounced than something else?
Well, I mean, I was working on a unit that was treating kids with eating disorders at the time. So we saw a big spike in that. Um, and, yes, I think the literature will show that there was a dramatic increase in suicidal ideation, suicide attempts, actual suicides, that sort of thing. So that was, that's kind of upstream. But then before that, you have, depression, extreme anxiety the kids are feeling. And I'm going to go back to your remember that time. It was an extremely anxiety provoking time. We didn't know what to do. And every day we were told to do something different. So people were really panicking about their basic safety, the safety of their families. It was tough.
And what do you think? What do you think have been the lasting impacts on adolescent health from the pandemic? I mean, it's obvious that internally, in my personal experience, like it 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 seems like we are still dealing with the aftermath. Like our the way that
Yeah.
we interact with one another has been changed, and it has been more almost antisocial. At the same time, we are, I live in New York City, which is a very, social place, and people are trying to, build that muscle back. That muscle atrophied, and people are trying to build it back. But I'm curious, what are we still dealing with? And then, specifically when it comes to adolescent mental health, like what have the lasting impacts been? Because, you have all these children that were not going to school at very important times for them developmentally. How has that affected the way that they interact with their peers, and how has that affected their mental health?
Well, there certainly has been a gap in learning and in education. So I think we're really going to feel the impact of that as as a generational issue.
Mm.
Um, but I really think it's the social change that is the biggest impact. Um, there was a real period of time where kids' only interaction with each other was through a device.
Yeah,
And that I think that really just warps things for kids. Their perception of the world changes when all the information that's fed to them is through a device with a particular app with a certain slant that it's trying to present.
yeah,
And you can think of it this way. A lot of the kids that I work with will say that um, they can get on their phone, they can start using it, and suddenly 3 hours have gone. Right.
yeah,
So
for
so
sure.
that's
Yeah,
traumatic, right?
yeah,
And I'm kind of working on a paper actually right now on the topic of boredom. And the premise is that boredom is actually a really important feeling.
mm,
And, I just think in my own life, it was only through times where I was bored that I would really push myself to do something that I ordinarily wouldn't have done. So that's, I might try to learn an instrument that I wouldn't have. I might go out with people that I wouldn't have, that sort of thing, because I didn't want to be bored. But these devices take boredom off the table. There's no boredom. Anytime you're bored, you pick up your device, and you see that very much in our society, right? You're standing in a supermarket line, and people are on their phone, they're scrolling, right? So there's
yeah.
no boredom. You have a constant source of entertainment that refreshes every few seconds. It's amazing. Um, but I think that really robs us of kind of the focus on, geez, what would I be interested in doing and learning and experiencing? And that's a big change for kids.
And it's so tricky because what you're saying, when you articulated it, it makes total sense. I can understand the importance of boredom, but it's very, very difficult to convince people, hey, when you're bored, scrolling on your phone is not good for you. Is there, I mean, in your experience, has there been like an effective way of really getting that message across? I mean, all of this seems so difficult because we're starting to have a conversation. It seems like we're in the very beginnings of having a a recognition and conversation as a society, at least in the United States, about the negative impacts of social media. But like, it's so difficult to get people to change their behavior because this is just your entire life is here,
Yeah,
and
yeah.
it's so easy to utilize. I'm just curious, like on the specifically on like the topic of boredom. Like, is there any, have you had any conversations, or is there any way that you've been able to articulate this that I don't
Well,
know,
that's
gets
like the
people to
million.
internalize this?
Yeah,
Yeah.
that's the $1 million question. What do we do,
Yeah.
right? So
Yeah.
everyone knows there's smoke in the house, but no one's calling the fire department yet.
Yeah.
And we tend to be reactionary. So I talk to a lot of parents who say, "Yeah, I take the phone away," that sort of thing. Well, okay, but that's also the only way kids communicate today. So you've essentially taken that out of their life. That doesn't work. So I'm much more in favor of actually families coming up with their own rules about it. And if you think about it, we all live lives of rules.
Mhm.
And we have society rules, but we also have personal rules. You know, I don't drink coffee after noon because it keeps me up at night. That's a rule I have. But we all have those kinds of rules. And we have to learn to make those kinds of rules for these devices. And I think that actually has to begin in families. So we wrote an article about, things like really important for parents to join with their kids on what they're learning through social media, and to really be able to talk about it, but also to create times when, as a family, we won't have our device available to us. So if your family happens to sit down to dinner every night, make an agreement that we're not going to be on our device during dinner. And that actually has to be followed by the parents too. So when I talk to parents, I say the first thing is, you got to check yourself, because you can't tell your kid not to be on their device when you're having it right next to you at the dinner table or in a restaurant and you're checking it every 4 seconds,
Yeah.
that sort of thing. So I kind of think like families have to develop rules or times. And, a big one for adolescents is don't bring it to bed with you. Basic sleep is interrupted. Nothing is that important in life that you have to have your device 24 hours a day. You could actually leave it on a kitchen counter and get it in the morning. That would be okay. But that would have to be a family rule. And I guess I would say it would hope for kids that they would develop practices like, I'm going to do my homework for an hour and then I'm going to scroll for a half an hour, and kind of build a reward system in for it, use it that way. Because I really think it is a little bit of a reward system. You just got to be able to set up a structure so you're working for the reward.
Yeah. Yeah, that makes a lot of sense. And I'm curious, like, what specifically when it comes to the impact of social media on mental health, when you were seeing all the in the pandemic, when you were seeing all these patients, what was the before we get into the child's experience, what was the parents' experience when they see their children dealing with these issues? Like, I'm curious kind of what these stories are like, what did they see change in their child, and what has their reaction been to the feedback that you just gave, which is like, you as a parent are required to help your child and create rules for your child. Like, what has the reception been there?
Well, I think parents are alarmed at what they see. They see their kids withdraw. They see them become much more introspective, less socialized with people, spending less time with people, and they see them on their device all the time. And you see that all the time. Kids walking down the street are looking at their phone. It's
Yeah.
amazing, right? It's not that exciting, but they're not open to the world around them. They're drawn to the device in front of them, and that really is that's a big problem. It really it removes people from the opportunity to let the spontaneous things of life occur before them. We had a really interesting experience at the hospital it was after the big part of the pandemic, but we're still getting these COVID outbursts. So we had a policy that if someone became COVID positive, they had to be in their room in isolation for 5 days.
Yeah.
So you can imagine for an adolescent, that's inordinately difficult. So in order to make it reasonable, we said it's terrible you have to be in your room in isolation, but you can have your device all the time. Because usually in the hospital, we have rules. You get it, for an hour after dinner or something like that. But if you're in your room on isolation, you have your device anytime you want. So I remember distinctly being in group, and we had like 3 kids who had been in their room in isolation, and they got out after 5 days. So they were rejoining the group for the first time. And I thought to ask them, I said, well, how is it? And they said, it's all right. It's all right being back. So I said, well, all right, if you had a choice, would you rather be in isolation with your phone all the time or out here with us? And all of them said, I'd rather be alone in my room with my device.
Ooh.
And I
Oh,
was
I
like,
know.
you've got to be kidding, right? But that was, and they were genuine. They really meant that. It was far more interesting to them and far more gratifying to be alone in a room with a device than out interacting with their peers.
Wow.
Yeah.
And what was it? Uh, what is it that is so gratifying? Because that's actually hard for me to relate to. I mean, like, social media is a time warp, and it's addicting for a number of reasons. But I personally wouldn't describe it as gratifying. How did they describe it as gratifying? What was so gratifying about it?
Well, I think the sites are built. It's kind of like on the premise of the fear of missing out on steroids, right? So whatever you see, it every once in a while it gets really interesting. So there's the constant reinforcement that the longer you stay on it, the better it's going to get. So it is quite compelling. It keeps people engaged over time. And even if you put it down for a moment, you can come back and it starts all over again. So it's that constant kind of reinforcement that fuels these kids actually to stay on their devices for a long time.
Hmm.
And think about it. I mean, you might say, well, it doesn't really do much for me. And that would be my response too. But developmentally, we're different, right? Our
Yeah.
brains are at a different point. For that age group, that kind of stimulation and that kind of focused uh, kind of interest is really, really something for the human brain, which is going through a remarkable development during those years, right?
Yeah. Wow. And how did they react to, I don't know, did those opinions change as they kind of re-socialized into the group setting?
Yeah. Oh, yeah. No, and it's interesting. When you take kids' phones away or their devices away, they actually do start to socialize with each other more. And some will even say, I kind of have missed this, or this is better,
Mhm.
I mean, they don't volunteer that easily, but it
Yeah.
does come back.
Yeah.
Um, I
Yeah.
mean, kids are kids, and you
Yeah.
hear about it, like kids that go to summer camps that don't allow phones in summer camp really have a very normalized experience.
Sorry, there's actually there's a fire truck here right now. I don't know if you can hear it, but
Better
I'll give
your
it
house
like
than
2 seconds to
mine.
pass. Yeah, yeah. I'm like thank you. Um, that's fascinating. So I mean, there is some sense that um we can kind of we can revert back to, I mean, we are like social creatures, and we can revert back to this.
Yeah, I believe that. I believe.
Yeah, that's good. I mean, that's hopeful. I'm also curious, like, are there, because social media now, I mean, means a bunch of things, but like I would imagine for young people, it's probably Instagram and TikTok. What apps in particular are you kind of do you see young people
Those are the
using?
two. Those are the two. Those are the
Yeah, okay.
dominant ones in the culture right now. Yes.
Dude, and I'm curious, like their experience on each of these. Do they kind of, is it kind of the same experience, or do they describe kind of different? Maybe Instagram is more the fear of missing out, and TikTok is like some sort of other kind of experience. But I'm curious, like if they've articulated how these apps make them feel, in different ways.
Well, it's interesting. I know, if you work in the field of eating disorders, um, you'll be directed to, information about how to get better at an eating disorder, how to get sicker. And certainly there will be a little bit about, the sites that might be more helpful, but a lot of it is quite destructive. And that becomes really a problem. If you're struggling with something like an eating disorder, you need a lot of positive information. And sometimes these sites can be very, very destructive in the information that they give them that is very pro their illness.
That's tough. And what I mean, I can kind of imagine some things, but just to put it to words, like what exactly is it that is kind of feeding their illness? Is it I'd be just curious to hear.
Well, I think eating disorders are incredibly complicated, so it's probably 25 different things that
Yeah.
are interplaying, to create an eating disorder. Um, but the mechanics of it, how to deny your body nutrition, are things that are taught usually, and there are certainly sites and there's lots of information on how people can continue to restrict, can fool their parents, that sort of thing. What you should be really looking like, um, that information.
Okay. So when it comes to social media, I would imagine a lot of that is perpetuated just via kind of signaling. People. This is my life. This is how I look. Like there's an element of fear of missing out. These kids obviously they kind of idealize these people, and then the
Yeah.
signal is like, look, you
Well,
don't
and
want to.
and I think just be, you know, I think we're learning that there are algorithms.
Yeah,
So people's profiles are tailor made for the type of information that they want. And then the type of information can be very slanted that they're receiving. So we really don't know a lot about that at this point. But I think that's real. And I think that has a real impact on a developing brain.
absolutely. And are
And,
there?
and
Yeah,
an example is just humor, right? So um, I don't know. I kind of grew up where, sometimes things were funny and people laughed, that sort of thing. But I'm really aware now a lot of the things that are put out to be funny are people being hurt. It's funny if someone falls down a flight of stairs,
mm,
and that's being put out kind of as that's a joke. Well, it isn't. You know, I hope they're okay. Maybe they broke it, but that sort of thing. But I do think that our sense of even humor can be quite slanted with the information that we're given.
yeah, absolutely. I mean, that is one of the things that I'm kind of more interested in when it comes to social media, is it seems like, particularly when we participate on social media, there is this lack of empathy, like, and that is displayed in what you just described, but it's also displayed in how people interact with one another. Like, there
Yeah,
seems to be,
yeah.
you don't have to deal with the face-to-face repercussions of an insult, and so people say really terrible stuff to each other on social media without those repercussions. And so it kind of, the guest I had before you was a psychiatrist, and he was kind of talking about like the internet's own shadow, how there are aspects of ourself that we do not really use in person to person interactions that manifest when we use social media. And I think there is that comes into play with like shame. Like, there's a lot of like shaming. There's a lot of just kind of vicious like ad hominem attacks. But there's very clearly there's like a lack of empathy that exists on the internet, which is really yeah, which I definitely see, and I imagine you do as well.
Well, yeah, no, I think that's a great point. Anonymity brings out a dark side of people. And yeah, it's a little bit like, kind of a group mentality, how a mob develops into something quite aggressive, that sort of thing. We lose our ability to check our behavior with ourselves and with people around us. And I think the anonymity that the internet provides really fuels that. You can see it I mean, even in Yelp or something like that, people say terrible things,
Yeah,
right?
yeah, it's
And
crazy.
without recourse, because they never would sign it and say that that's me that said it, you know. So it's right. It brings out quite a brutal side of people.
Yeah. What when it comes to social media's impact on mental health, how do these kind of issues in mental health manifest differently between men and women? I'd be curious to learn more about that. Are boys and girls, perhaps?
Um, I'm not sure I know the answer to that, but I would bet that there are differences. There are gender differences. Now I see a lot of kids, a lot of boys into more gaming,
Mhm.
and that becomes an anonymous in social interaction around something that's usually competitive. Um, but I think girls and young women, I don't know, perhaps, you know, I don't see as many in the gaming world, but I certainly see them influenced by, the messaging of what beauty should look like, or,
Yeah.
what they should look like, the ideal. And it's really interesting if you think about it, because I would say, everyone in the country has tried to change the way they look in some way. We've all gone on diets, we've all tried exercise, we do different things because we all feel like there's another ideal out there that we should be chasing. And I think social media really speeds that up. It really feeds kind of an ideal that people should reach for, that it can be quite damaging, as opposed to kind of the belief that, you're kind of okay.
Yeah, I agree with that. And it seems, yeah, particularly when it comes to young girls, there is a lot of body stuff going on, and images. Yeah, this is what beauty looks like, and
Right.
It does seem, I mean, just speaking into my own experience, I mean, it does seem like I see a lot, even in, of course, in adult women, like there's a lot more lip filler, and there's a lot more kind of there. It seems like there's almost like a templatized type of beauty where women dress, a certain subsect of women like dress and kind of like present beauty the same way, which is very um like weird and scary and kind of dystopian. Like they're like little copies of one another. But I think a lot of that comes from social media, because if you have these filters that kind of look like this, and
Right.
um, it changes the way people look. Yeah, it's very, very odd.
Well, you think about it, we kind of grew up in this country with the influencing of marketing, really telling us,
Yeah,
what we needed and why we needed it, what we have to look like, that sort of thing. And that's very much at play here, right? So it's kind of preying on our need to have some kind of direction, and we're very susceptible people.
yeah,
So yes, we feed into that. And the messaging is so quick and it's so concentrated that people fall right into it. It's very hard to retain a sense of individuality, um, who I am, what I'm interested, and to feel that that's okay.
yeah, absolutely. Tell me a little bit about. I mean, this is quite foreign to me. I don't work in the mental health world. When it comes to suicide amongst children, like how does that start to manifest? Respect to maybe just even taking social media out of it, but how does maybe some of the negative symptoms of social media kind of heighten those tendencies or those desires?
Well, uh, I mean, first of all, you have to understand that adolescents, have they have an invincibility feeling to them. They don't actually think death is final. They
Yeah,
kind of think, if I'm mad at you, I'm going to kill myself, and then I'm going to watch you be sad, or something like that, right? But
yeah,
they've had tremendous exposure to role models who have killed themselves, and a lot in the
mm,
music world, right? So that kind of um, that kind of thing actually gets a lot of attention, and it gets really kind of elevated. So, when I was growing up, that was actually something that was rarely heard of. But I think today that's on the table. If things don't go well, that's an option for me, that sort of thing. And that's because it has really been part of their culture. And I think it started with, musicians, and then I think it has spread. I think I don't think there's anyone now that doesn't know someone in your
mm.
school, in your classroom or something, that has either succeeded or tried.
Wow. And I would also, I think social media plays into this because you're aware we're overstimulated. You're aware of things that are happening in other countries, other states, other cities.
Well, so
Uh,
true, right?
yeah,
So if you have something you're aware of in the world, um, with social media, the world is in your backyard now. So if it happens in Florida, it feels like it happened next door, that sort of thing, and it's right presented to you. So the world becomes a much more frightening place and a much more dangerous place that way.
Hmm. So if I'm, and correct me if I'm wrong, if I'm understanding you, it sounds like what you just said is social media has allowed, you have a lot more stimulation and a lot more awareness of people that have, committed suicide or harmed themselves. Um, so there's like a increased ability to like imitate, or there's like, this influence, like people have done this and, they probably got a lot of attention for it. So as a, you know, young people, I guess, are aware of this as like a perceived option. But
Right.
I'm also curious. I mean, kind of more central to um, feelings of like loneliness and self worth. I mean, how especially in teens and related to like social media, has social media how has social media increased suicide in kind of that way?
Well, I don't know if we can make that conclusion yet. I think we
Hmm.
we know kids are watching, or kids are on a lot of social media, and we know our suicide rate is increasing with kids. I don't know if there's a causation yet, or I believe there's a relationship, but I wouldn't say there's a causation that we know of yet. Um, but I would say that um, I think our kids are feeling more isolated and alone than they have in the past, and those are really the drivers of feeling like you want to harm yourself or that you'd like to kill yourself. So with that, I think it becomes a more dangerous time.
Yeah. And I think everybody's feeling those feelings, which is really kind of
Yeah.
the one of the central problems about the pandemic, but also social media. And I guess there's just such irony here because social media is supposed, these are social networks. They're supposed to connect us to communities that we wouldn't have met before, and and they do. I mean, you are able to meet and befriend people um, that are interested in the same things of you in other states and other parts of the world. But at the same time, when we look at like the negative effects that you're talking about, the negative effects are loneliness and isolation, which is the opposite of what these networks are supposed to create.
Yeah. So no, good. I mean, fair point. And I think that's really important to know that there are really wonderful things about these devices.
Yeah.
And you're right. They can certainly connect people. They bring families closer that are living at a distance. They're really
Mhm.
wonderful that way. I think for an adolescent particularly, who struggles with a sense of loneliness or a sense of isolation, it can also go the other way. And that's kind of the danger. And it's I guess my message is, not that these are bad and we have to get rid of them. Not at all. These are really important devices. We have to learn how to manage them, and I think we have to learn in families how to manage them.
Yeah, absolutely. How have, I mean, in your experience, how have you been able to, or how can we kind of make people, old people and young people more aware that the things that they are experiencing and seeing on social media are unrealistic?
Isn't that's a really interesting problem, right? Because we're entering a time where we're starting to question information.
Yeah.
So basic information is now viewed with skepticism. Um, and I think that I really don't know the answer to that. I think that's going to be a real challenge moving forward. But I think the first step of that is just introducing the idea that everything you hear is not true. And it's funny, I I hear it from the kids I work with. They kind of they'll talk about something. I say, "Well, where'd you hear that?" They said, "Well, I heard it on the internet, so it must be true," which is a joke, right? They're
Mm.
acknowledging
Yeah.
that some of the stuff is not true on the internet. So
Yeah.
we kind of have to get that message out,
Mm.
and they start to have to really feel it. You have to be a real skeptic with information that you're obtaining. You can get all the information, and a good deal of it is distorted or untrue.
Hmm. How has I mean, you're writing papers. You've written papers about these issues, and you're writing more papers about these issues. How has the mental health field reacted to social media usage, and kind of what are some of the conversations being had at your level?
Well, I guess it's a little bit frustrating. A lot of people, there's a real need to have information and the science of it. It takes so long to do a study, to get a study published, that sort of thing. And that's kind of my thought. And I wrote about it. We wrote about it, Cam and I, in one of our articles. You know, this was this was a freight train, a speeding freight train that came through your house and you didn't know it. It's not something that we could planfully anticipate. No family was able to planfully anticipate what a device would do. And I think that's how this is different than other things that have happened in our society. This is happening at such a quick speed that by the time we have laws in place to address today's challenges, we'll be at a whole different place,
Yeah.
and there will be enormous new challenges. So, you know, I'm a little impatient with waiting for what the data will tell us, and that's kind of that's the awkward position I'm in. I sit with these kids, I kind of see it, I can perceive it, um, but yeah, we don't have the demographic studies down yet showing the true impact. I think that will come, but I do feel we have to start to do something about it.
Yeah. Yeah. in your view, does that reaction, doing something, does that start with you mentioned the family? Is that how, I mean, speak for yourself, but I'm also kind of curious how other people in your job description are dealing with this, because
Well, I
it seems
think
like we have to create a barrier between, or we have to, it requires more discipline. Seems to be like the overwhelming answer that I've heard. But I'm curious if maybe you're hearing other things or you've thought about it differently.
well, I think there have to be a number of things done. I think that it's really interesting that our Congress is united around trying to do something. So, that's dramatic to me. So I think
Yeah.
we have to do something on the federal level in terms of protecting people and protecting kids particularly. Um, in my world, yes, I first think the line of defense is parents. And I really, to be clear with people, it's really important. It's incumbent on you to kind of set up rules for your family, but you got to follow the rules yourself. So, you can't tell a kid not to smoke if you're smoking yourself. It's kind of
Yeah.
that kind of thing, right? Um, and and then I think it's about really coming together as a family and agreeing to things. During certain times, we're going to put our devices away. We're going to interact with each other rather than our device. Um, and then I actually think it's really a workplace issue also. I worry a lot about people in their workplace really having their phone in front of them and attentive to that and trying to do a job. The human brain cannot multitask like that.
Yeah.
You know,
Yeah. Yeah. Interesting. And tell me a little bit more about the paper. You touched on it, but like the paper or other papers that you're writing about, like specific to mental health and social media, but also maybe just outside in the when it comes to mental health. What are you thinking about right now? What are you involved in?
what am I involved in? Well, so I have a book that's coming out in January that I co-wrote with Stuart Coleman, actually on behavioral health systems of care. So it's about how to design and operate a system of care. So that's kind of been um, more of my administrative work over years. I'm working on a project now as a co-editor on eating disorders and how to train clinicians to work with people with eating disorders. And then somewhere down the road, I hope to be able to put together stories that I have over my career of events that have happened in the hospitals that I've worked in that are both dramatic and beautiful,
Hmm.
that are kind of really humane stories about, the struggles people are going through and how they, how they work out in a psychiatric hospital. So,
That sounds. I would definitely read and buy that book.
yeah, well, we'll see. It's interesting. It's a project I haven't all written because it's kind of helped me over my career. When I go through a very intense experience, I write about it. So
Oh,
I have
awesome.
all these chapters and I got to put them together and uh, and do something with it. I don't know what to do with it, but
If you don't mind sharing, could you maybe give me a taste of kind of what these experience what a one of the experiences that you're describing is something that just
um,
come.
sure. I mean, I worked with one of the most suicidal kids I've ever worked with. So kind of talking about that experience and then working with him and learning what that was about and how to kind of address what was really his self-hatred with the behaviors that he was doing and how to try to move away from that and to introduce other things. So all the stories are completely anonymous, so it's all
Yeah,
de-identified, but really talking about an experience like that. uh, yeah.
that's amazing. Yeah, I am also curious. I mean, I don't know really anything about eating disorders, but you brought it up several times, and I'd maybe like to touch on it a little bit. Just kind of from like a macro level, particularly when it comes to adolescence. How do symptoms of eating disorders and how do eating disorders start to develop? What does it take for these things start to plant seeds into young men and women? And I'm also curious, I mean, at least from my kind of common knowledge, it seems like eating disorders are more popular in women, but tell me if that's true or not.
They are more popular in women, but certainly are growing in men and boys. So we see more and more of that. You know, it's interesting. When I started working in eating disorders, I used to think it was like one or two things were the cause of an eating disorder. So I no longer think that. I would say it's probably 25 things working in concert that
Hmm.
create the environment for an eating disorder. And one of them is genetics. So we definitely know through the research that there's a genetic predisposition for some people to have an eating disorder. Um, but that being said, you know, everyone I've interviewed, I always say, can you tell me how this started? And everyone has actually kind of a beautiful story. You know, I I wanted to start exercising so I could make a team in high school. Um, I wanted to be able to fit into a dress to go to my prom. I wanted to go running with my mother. You know, like really nice things.
Yeah.
Um, but for some reason, for certain people, those really good things get very out of control. And we don't quite understand that or why that happens. But instead of an individual having control over something that they're trying to do to improve themselves, suddenly it flips and that thing has now control over them. And that actually can get to a very dark place. So I also ask people when I interview them, I say, can you tell me when you realized it was out of control? And they can talk about that. Then it becomes very scary. You know, this thing that I thought was helping me, suddenly I couldn't get away from. Um, so very, very challenging to work with.
Hmm. And you mentioned it's on the rise in young boys and men. Tell me a little bit about that. I didn't know that. I found that interesting. In your experience in interviews, what have you noticed?
Well, certainly, you know, in athletes, right? So, you know, there are certain sports where your weight is really
Yeah.
important. You're really monitored for your weight and you have to train to your weight. So, for certain people, that can get quite out of control. And when that happens, it can really develop into an eating disorder.
Hmm. Is that new though? It's, I mean, I think you're alluding to wrestling, you know, in particular. I'm sure there are other sports where you have to monitor your weight, but like, is that really? I mean, wrestling's been around for a long time. Are there any kind of more kind of current themes that you've recognized that have maybe contributed to that uptick in
Well,
eating
I think
disorders
I
amongst
think
men?
you know, with eating disorder, there are what we call behaviors. You know, so yes, I think there's an increase in the behaviors people are using, and I think people are learning about how to use behaviors. And I go back to, you know, through social media often telling people this is how you can lose 5 pounds a week, that sort of thing.
Yeah.
You know, that sort of thing. You can be really thin if you just do this. Um, and I go back to for you know for some people it isn't as damaging, but for others it just gets really out of control. And those are the people I see. You know, the ones that it gets really
Mhm.
out of control.
Yeah. Hmm. Yeah, I do think, you know, I'm just speaking anecdotally, but I do think, you know, there is this kind of stereotypical kind of image of beauty when it comes to you know, women in social media, the lip fillers, certain, you know, there's a certain look, and I think on the male side, this also exists, and it has been kind of created and perpetuated through social media, and that is like it seems like there's a really, just speaking experientially, like it seems like there's an uptick in like the kind of men getting into bodybuilding, like that kind of image, you know, huge arms, huge chest, and I think to your point, it comes from a good place. Like I know a lot of people that have gotten into, you know, myself included, like have got didn't have any muscle, got into you know, lifting weights, and like you experience a tremendous, you know, there's like more confidence,
Yeah.
but there's also kind of this there's a point where I have seen people, you know, take it too far, and that, you know, there's like there's a paranoia about, you know, eating certain calories, so you make sure your abs are looking good, and there's, you know, this constant kind of necessity to like maintain your figure. I do notice it on the male side as well.
So I think that's true. I use the analogy, the goalposts are always moving.
Yeah,
So whatever goal you set for yourself, whenever you reach that goal, then there's another one, that sort of thing. And that's kind of the thinking that develops into a disorder. When you can't get to a point of being comfortable with who you are and where you are, it becomes the drive to continue to pursue that. And
yeah,
eventually things start to break down. Bodies can't take that kind of systemic use and overuse. So yeah, it's very interesting. You should do a whole podcast on eating disorders.
yeah. No, I mean, hey, if you ever want to come back, we can talk about it. We
Yeah,
can
yeah,
go
no,
deep into the
I would do
weeds.
that. Yeah, yeah,
Yeah, awesome. Okay, good, good. I know nothing about it, but I'm very fascinated by it.
yeah.
And I'm fascinated by, personally, I'm fascinated by mental health and mental health disorders.
Mm.
And we live in a really turbulent time. The pandemic changed things, and it seemed like a paradigm shift happened.
Absolutely,
So
absolutely.
we're like you said, we can't really prove a lot of this stuff, but experientially, we know a lot of things are to be true. So, my take is like the conversation that we're having is what we can do to kind of bring it to light.
Right.
Say, okay, well, let's just kind of talk about our experiences and try to sift out, what you're experiencing and I'm experiencing, what seems to be kind of true. Um, Specific to social media and mental health, I also think the the idea, and I kind of touched on it earlier, but like there seems to be an issue of self worth amongst people. There's this fear of missing out, and there's this fear that I'm not having there's a depression that I'm not as happy as other people, and I'm not as social as other people, and I'm not as beautiful as other people. And I'm curious from your experience, what can we do, particularly in teens, but also amongst adults, like how do we combat that? How can people
Yeah.
um, reject that and build a sense of self-worth?
Well, I think that is a social media issue. You look on social media, and everyone looks better than you, and everyone's having much more fun than you are. So the message is quite damning. You don't fit in. There's something wrong with you, and that's really the damage of it. So what can we do? Um, I think we really have to work on a positive orientation for kids, and what they're doing, that they're doing well. What strengths do they have? They have to be able to hear that and really feel it.
Hmm.
Um, but we're an incredibly competitive society, so I really worry about that. Every kid wants to become a professional athlete. That's not going to
Yeah,
happen. You
yeah,
know. So what happens when that dream isn't realized? And how do kids feel like they have something in life that they're really passionate about, that they're really drawn to, and that they can grow with? That's kind of that's so important, right? When you wake up in the morning, what are you excited about?
yeah. Hmm. Yeah, I think that's a. It seems like that is something that a lot of people mute out,
Yeah,
um, because we are, like you said, we're incredibly competitive, and especially at the highest level. You have a couple of different types of jobs that everybody's competing for. It's like, but
right.
if you told me as a 9 year old that you want to be a consultant or an investment banker, obviously I'm going to laugh at you because that's not really like for 99% of people that's probably something that you're not truly passionate about. But it's more a job that requires an intense amount of hard work and pays you for it. But like um, the idea that people should be listening to what excites them, I think, is important and kind of forgotten.
Well, and I would add, I think we live in a really interesting time, and kind of my pet theory is that we're the first time, for the first time in this country, we have a generation of Americans that may not do better than their parents did. And that
Hmm.
is interesting, right? So, you think
Yeah,
about even just buying a home, something like that. That's really out of reach of so many people in this country at this point. So I think that makes people more competitive with each other. And you see
Yeah, for sure.
parents pushing their kids to, achieve, whether it's athletically or academically or whatever, because they want those kids to be really successful and to do as well or better than they did. And that's the fear and the competition that's being bringing out in people.
Yeah, I think comparison can be a huge problem and source of lack of self-worth for people when they're in this is perpetuated with social media when they're comparing when you're comparing your happiness and you're comparing the way that you look to all of these Instagram models or
Right.
something like that, like but at the same time I think I don't know, it's not, I mean, none of these things, it's not black and white, none of these things are inherent. I don't think inherent comparison's not inherently bad.
Right.
um
Right.
and I'm also curious, like how do we kind of walk the tightrope of promoting self-worth, um and promoting that positive talk, but also being realistic. One of the and I'm not sure that this critique is totally right, but like one of the critiques of kind of this younger generation is that they're too soft, that everybody's getting participation trophies. Like how do we balance that?
Well, I don't know. I tell the people I work with that they have to find someone they can talk to honestly.
Yeah.
You know, and I mean, in my world, that's I'm a therapist, so I think there's a value in a kid having someone that they can talk to honestly and kind of really reality check their experience with that someone else thinks. But it doesn't have to be a therapist. But I think everyone has to have someone.
Yeah,
So it has to be a teacher. It has to be an adult who has a just an interest in someone doing well. Um, because I think the misinformation is overwhelming, and kids need to check it out, and find out what's true and what's not.
absolutely. And how do your conversations differ in the group setting versus the individual setting? I'm not sure if you see children individually, but you alluded to this particular patient that had
You know,
suicidal ideation, and then you also alluded to working with groups. So I'm kind of curious, like, what are the dynamics in each of those scenarios, and how can group therapy and individual therapy um, positively impact a child?
well, I mean, the challenge working with a child or a kid is to get them to talk,
Mm,
because they really struggle with, first of all, knowing what their feelings are, and then it's really hard to put them into words. Um,
yeah,
So, a group setting is kind of a circus unto itself. It can take off, and sometimes it can be really positive and constructive, but other times it really isn't. It depends on the mix of the kids and where they are and what's happening. But you really try to facilitate some kind of interaction between the kids and the group. Um, it's a little different with individual therapy where you're just working one on one with someone. And you know it, that's really about building a relationship with a kid. So if you actually can build a relationship with a kid, they'll talk to you about anything. They love to talk about things once that's in place. But they have to feel like you're an okay person. You aren't going to be judgmental of them, and it's safe.
yeah, yeah. Um, we're coming up on time, but maybe
Right.
kind of final thoughts. I'm curious, like 5 years from now, I think social media and mental health are we're gonna understand more. We're gonna see more. There will be more evidence. Um, but I'm curious, as you go forward. I mean, you're working in this intersection and you're aware of all this. I mean, going forward, um, I don't know how. Very broad question, but how should people think about their social media usage and and their mental health, and how can we be how can we be healthier when it comes to
Well,
uh,
yeah.
social media?
I believe personally, anything in moderation is probably okay. So I think you have to figure out what's in moderation for you, and I would bring that back to a family kind of discussion. I think it's really important to be aware of the power of these devices and the information people are getting. And it's a little not like that. I mean, if you think about it, you know, when you get a driver's license, you're really taught that this is a powerful machine here, you know, and it can go dangerously fast, and you have to be very careful. When you get a phone, you're not given that kind of advice. You know, hey, you got your first phone, life's great. You know, I think people need to understand that, you know, it's potentially a very dangerous thing, and it has to be carefully used. And really, there can be safeguards put in place. So I think that kind of stuff is really important. Um, you know, what's going to happen in the future? I don't know. You know, mental health people are terrible at predicting the future. Um, but I'll tell you, I'm worried about it. And what I'm really worried about is that it will erode the social fabric that we as people have. You know, it brings us more into ourselves and less connected to others. Um, so I really, you know, I'm a big believer at work. You know, don't send me an email. Don't text me. Come and talk to me. You know, you get so much more information, and you feel so much more connected to people when you speak to them. And we have to be able to retain that.
Yeah, I agree, and well said.